Next, let's move forward, and we want to welcome Yuri Edwards, Medical Director, U.S. Medical Affairs Neurology from Alexion, to tell us more about SOLIRIS. Yuri, please.
Michael, thank you very much for the introduction and for the opportunity. And welcome to managing neuromyelitis optica spectrum disorder through complement inhibition. Thank you very much for attending this event, and thank you very much for Guthy-Jackson Foundation's invitation to present important information about NMOSD and about available treatment options for this disorder. Alexion is the maker of an FDA-approved treatment for adults with anti-aquaporin 4 or AQP4 antibody-positive NMOSD. And the content in this presentation intended as educational information for patients and their caregivers. This information is intended as does not represent a medical opinion or doctor's medical judgment, and we encourage you to speak with your treating physicians to confirm a treatment plan and design a clinical approach to your disorder. It is very important to note that the prescribing information for our therapy is available on the Alexion website. I'm going to start by talking a little bit about Alexion and its commitment to the NMOSD community. Then I'm going to talk a little bit about NMOSD and the complement system, which is an important part of your immune response that, when uncontrolled, plays an important role in the damage seen in NMOSD. And lastly, we'll discuss a treatment option that may help reduce your risk of NMOSD relapse. So you have heard already a lot of information about what NMOSD is, but originally this disorder was discovered back in 1894, and it was first called Devick's disease. It took over 100 years before the diagnostic criteria for NMOSD were developed. In 2007, Alexion received its first approval for a complement inhibitor therapy that in 2019 was also FDA approved to treat adults with anti-AQP4 antibody-positive NMOSD. Alexion's complement inhibitor therapy has been FDA approved to treat 4 different complement-related diseases. It has been studied in more than 50 clinical trials with more than 50,000 patient years of safety and efficacy data. Patient years are calculated by multiplying the number of patients being observed by the number of years of observation. For example, if a clinical trial followed 100 patients for 1 year each, it would equal 100 patient years. Or if the trial followed 25 patients for 4 years each, you'd also get 100 patient years. Post-market experience is defined as the length of time that has passed since the therapy has been approved by the FDA for its original indication. In total, Alexion has 5 FDA-approved medicines that treat 7 rare diseases and conditions, including anti-AQP4 antibody-positive NMOSD in adults. So what is NMOSD? It's an autoimmune disease that causes your immune system to attack your central nervous system. These attacks are also known as relapses. They are unpredictable and may be severe and recurrent, primarily causing damage to your nerves in the optic tract and the spinal cord. What are antibodies and why are they important in NMOSD? Around 73% of patients with NMOSD have the anti-AQP4 antibody. An antibody is something that your immune system produces to help fight off anything that your body thinks is a foreign or dangerous matter. In anti-AQP4 antibody-positive NMOSD, the anti-AQP4 antibodies cause your immune system to attack your CNS instead. These antibodies activate complement system, and therefore they protect your body from threats such as certain types of infections. People with anti-AQP4 antibody-positive NMOSD have a high risk of relapse. In fact, up to 93% of people with anti-AQP4 antibody-positive NMOSD have relapsed during the course of their disease. In a healthy person, complement receives signals from antibodies, telling it to attack things like bacteria and other threats. In NMOSD, complement is wrongfully triggered by anti-AQP4 antibodies to attack areas of your central nervous system. That uncontrolled activity can cause inflammation and damage to cells in your optic nerves and spinal cord. Complement plays a crucial role in the damage found in the optic nerves and spinal cord in anti-AQP4 antibody-positive NMOSD. Fortunately, there is an Alexion FDA-approved treatment specifically designed to target and block complement. SOLIRIS is the first and only FDA-approved drug for the treatment of adults with anti-AQP4 antibody-positive NMOSD. It is prescribed to treat adults with a severe NMOSD who are AQP4 antibody positive. It is not known if SOLIRIS is safe and effective in children with NMOSD. What is the most important safety information that you should know about SOLIRIS? SOLIRIS is a medicine that affects your immune system and can lower the ability of your immune system to fight infections. SOLIRIS may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. You must receive meningococcal vaccines at least 2 weeks before your first dose of SOLIRIS if you are not vaccinated. If your doctor decides that urgent treatment with SOLIRIS is needed, you should receive meningococcal vaccination as soon as possible. If you have not been vaccinated and SOLIRIS therapy must be initiated immediately, you should also receive 2 weeks of antibiotics with your vaccinations. If you had a meningococcal vaccine in the past, you might need additional vaccination. Your doctor will decide if you need additional vaccination. Meningococcal vaccines reduce but do not completely eliminate the risk of meningococcal infections. You need to speak with your doctor or get emergency medical care right away if you get any of these signs and symptoms that could be indicative of a meningococcal infection. These signs could include headache with nausea or vomiting, headache and fever, headache with a stiff neck or stiff back, fever accompanied by rash, confusion, muscle aches with flu-like symptoms, and eyes that are sensitive to light. So now I'm going to talk a little bit about PREVENT clinical trial that led to approval of SOLIRIS by the FDA. In the PREVENT clinical trial, SOLIRIS was shown to significantly reduce the risk of relapse. For this trial, 143 adults with AQP4 antibody-positive NMOSD were enrolled. 96 of them received SOLIRIS, whereas 47 received placebo. The duration of the study was over 3 years. In the PREVENT trial, immunosuppressive therapy is well allowed, although some people only received SOLIRIS as part of their participation in the clinical trial. The goal of the study was to determine the time to first adjudicated relapse. An adjudicated relapse means that an independent committee of medical experts confirmed that a relapse has indeed occurred. SOLIRIS is only available through a program called the SOLIRIS REMS. Before you can receive SOLIRIS, your doctor must enroll in the SOLIRIS REMS program, counsel you about the risk of meningococcal infection, give you information and a patient safety card about the symptoms and your risk of meningococcal infection, as mentioned before. Make sure that you are vaccinated with the meningococcal vaccine, and if needed, get revaccinated with the meningococcal vaccine. Ask your doctor if you're not sure if you need to be revaccinated. So in the PREVENT clinical trial, there was a 94% reduction of relapse in patients who were treated with SOLIRIS compared to placebo. In addition, 98% of people who received SOLIRIS were relapse-free at 48 weeks compared to 63% in the placebo group. As mentioned before, you must receive meningococcal vaccines at least 2 weeks before your first dose of SOLIRIS. You should receive a vaccine called MAN-ACWY, and you need 2 doses of this vaccine at least 8 weeks apart. In addition, one of the other 2 vaccines should be administered as well. It could be either MAN-B4C or MAN-B-FHBP vaccine. MAN-B4C vaccine should be administered with 2 doses at least 1 month apart, whereas MAN-B-FHBP vaccine should be administered with 3 doses at 0, 1 or 2 months, and then at 6 months. Also, make sure that any necessary booster vaccines are administered with consultation with your physician. SOLIRIS is given as an infusion through your vein. Dosing occurs in 2 phases. Initially, infusions are given weekly for the first 4 weeks, followed by a 5th dose 1 week later. Then, infusions are given every 14 days. Your doctor will discuss the ongoing timeline of administration with you. Infusions last approximately 35 minutes in adults, plus 1 hour to monitor for infusion-related reactions. In addition, home infusions may be available based on your insurance coverage. SOLIRIS was studied for over 3 years in patients with anti-AQP4 antibody-positive NMOSD in the PREVENT clinical study. The most common side effects in people with anti-AQP4 antibody-positive NMOSD treated with SOLIRIS include common cold or upper respiratory infection, pain or swelling of your throat and nose, also known as nasopharyngitis, diarrhea, back pain, dizziness, flu-like symptoms, joint pain, throat irritation, and bruising. In conclusion, you cannot predict relapses with NMOSD, but you may be able to reduce the risk with SOLIRIS. SOLIRIS is the first FDA-approved treatment for adults with anti-AQP4 antibody-positive NMOSD. In the PREVENT clinical trial, patients receiving SOLIRIS experienced a lower risk of relapse compared to patients receiving placebo. In fact, there was a 94% reduction in risk of relapse with SOLIRIS compared to placebo. In addition, 98% of adults treated with SOLIRIS were relapse-free after 48 weeks compared to 63% with placebo. And the most common side effects included the common cold, nasopharyngitis, diarrhea, back pain, dizziness, flu-like symptoms, joint pain, pharyngitis, and bruising. Thank you very much for joining us today. And please see full prescribing information and medication guide for SOLIRIS, including boxed warning regarding serious meningococcal infection, provided at this presentation and also available at the Alexion website.
Yuri, thank you very much. We really appreciate the information. And now we'll go into the same questions that we had with the other presentations, Yuri, but now focused on SOLIRIS. First of all, patients are very interested in, the question, do they need to be off of their current treatment for a certain amount of time before starting on SOLIRIS?
Decisions about the choice of therapy in NMOSD are very important. And we recommend that you speak with your physician about NMOSD and any concerns that you may have regarding the risk of relapse during treatment transition. Your treating physician should evaluate this relevant clinical information and provide their recommendations based on the criteria and details that are specific to your situation.
And Yuri, I'll just ask the question the other way around as well, just for thoroughness. If a patient is already on therapies that are intended to help stop relapses, can SOLIRIS simply be added to those therapies?
In the PREVENT clinical trial of SOLIRIS for NMOSD, patients could participate if they were on a stable dose regimen of immunosuppressive therapy, or if their corticosteroid dose did not exceed 20 milligrams per day. And as I mentioned, when patients consider potentially adding another drug to their therapy, they should speak with their physician, who will assess their clinical situation and will provide expert medical advice based on important factors that have been identified.
Thanks a lot, Yuri. Another question that is important to many patients: why is SOLIRIS better than drugs that are not approved for NMOSD?
As we have seen already today, there have not been any direct comparison studies that evaluated safety and efficacy of different drugs that have been used to treat NMOSD, both those who have been approved by the FDA and those who have been used off-label. Therefore, the decision to use any specific therapy in the clinical management of this disorder will depend on many factors, and these factors should be clearly evaluated and discussed with your treating physician.
Thanks, Yuri. You covered, potential meningococcal infection. Patients are also interested, are there other risks of infection with SOLIRIS, including PML?
In the PREVENT clinical trial, as I mentioned, the most common infections in people with anti-AQP4 antibody positive NMOSD who were treated with SOLIRIS included common cold and nasopharyngitis. In the PREVENT clinical trial, no PML cases or cases of meningococcal infections occurred.
Great. And with respect to who can be prescribed SOLIRIS, questions come in, Yuri, that relate to, is SOLIRIS safe and effective in young adults, say folks who are just beyond pediatric age, let's say, for example, 20 years old?
Yeah. Patients who participated in our clinical trial were between 36 and 50 years of age at initial clinical presentation. In the future, we hope that more information may become available about the real-world use of SOLIRIS in patients in other age groups. In the interim, you should always speak with your doctor about your NMOSD, any specific symptoms that you may be experiencing, and your treatment options. As you know, SOLIRIS has been approved for use in anti-AQP4 antibody positive NMOSD in adults starting with 18 years of age.
Thanks, Yuri. With respect to ongoing use of SOLIRIS, is there routine monitoring or blood work or other tests that are needed? And if so, how often are those needed?
Patients with NMOSD who receive SOLIRIS are not routinely monitored for changes in their blood or by using any other tests. In terms of the safety considerations, as I mentioned, if you're experiencing any specific symptoms that might be indicative of meningococcal infection, it is important that you discuss them with your physician, who would be able to conduct proper clinical evaluation and diagnosis. However, any routine monitoring is not required for patients who receive SOLIRIS.
Thanks, Yuri. And then with respect to actual dosing, can you say a few words about how well tolerated is SOLIRIS, and is pre-medication needed to avoid adverse reactions?
In our clinical trials, no patients experienced an infusion reaction which required discontinuation of SOLIRIS. However, there is a potential risk that these infusion reactions may occur, which may include hypersensitivity reactions. Therefore, if patients have had any history of allergy to any components of SOLIRIS, they should not be receiving our therapy. Also, as mentioned earlier during the presentation, patients must receive meningococcal vaccines at least 2 weeks before their first dose of SOLIRIS if they're not vaccinated. If their physician decides that urgent treatment with SOLIRIS is needed, they should receive meningococcal vaccination as soon as possible. And finally, if they have not been vaccinated and SOLIRIS therapy must be initiated immediately, they should also receive 2 weeks of antibiotics with their vaccinations.
Thanks, Yuri. And then with respect to who can use SOLIRIS, Patients ask, can SOLIRIS be used during pregnancy or if one has an autoimmune disease in addition to NMOSD?
There are limited data on outcomes of pregnancies and patients with other autoimmune disorders based on our clinical trials. Pregnant women were excluded in the PREVENT trial. However, we know of cases of women who became pregnant during the trial and delivered their babies. These data have not identified any concerns for specific adverse developmental outcomes in pregnancies. In addition, patients who receive SOLIRIS have not been identified with any additional background risk of unfavorable pregnancy outcomes to our knowledge.
Great, Yuri. And last but not least, of course, patients are very interested in whether Alexion has programs to assist them in gaining access to SOLIRIS.
Alexion offers a complementary personalized patient support program that is called OneSource. OneSource is designed to support specific needs of patients with NMOSD. This program can support patients with disease information, health insurance navigation, and community connections, as well as ongoing support while traveling or during various life changes. OneSource has been designed to serve as a bridge between the patient and their physician to ensure that the integrity of their treatment plan is maintained. We have OneSource case managers who can serve as a valuable resource along your patient journey. They can help in several important ways by providing educational and useful disease information that's related to NMOSD. These resources could include brochures and website resources, as well as addressing your questions about treatment logistics. In addition, OneSource case managers can also help with health insurance navigation in several important ways. For example, they can help with information to understand the insurance plan and coverage options. They can find information on alternative funding options and resources if you have funding concerns or gaps in coverage. In addition, Alexion also has a copay program that helps eligible patients reduce out-of-pocket costs that are related to treatment or infusion. OneSource also provides ongoing support to help when the treatment location or insurance coverage changes to facilitate smooth transition. And OneSource can also help with community connections by providing information about in-person and online meetings and events, patient support meetings, and advocacy groups.
Yuri, thank you so much. Very, very helpful information.